Ahmednasir Abdullahi says Aden Duale should never apologize for reforming Kenya's health sector. Willis Evans Otieno calls the move sabotage. In between, SHA is scrambling to explain how millions were transferred to ghost hospitals. Data has disappeared with the shutdown of the Master Health Facility Registry, and Kenyans are left asking, who is protecting patients and who is protecting thieves?
700,000, 2 term. Confirmation 800,000, 2 term. Confirmation 900,000, 2 term. Confirmation 1 million.
Senior Counsel Ahmednasir Abdullahi was among the first to step in, shielding Duale with blunt words. CS Aden Duale shouldn't apologize for reforming the health sector. Let them continue wailing and wishing for the old order. His framing is clear. Those crying foul aren't worried about patients. They are nostalgic for the corrupt system that reforms are dismantling. In his telling, Duale is a reformer standing against cartels that fear exposure. But lawyer Willis Evans Otieno cut through with surgical precision. Disabling the Master Health Facility Registry is deliberate sabotage. Duale must tell the country whose interest is being protected, the patient or the thief. Because no competent administrator hides data unless the rotor leads right to his desk. For Otieno, this isn't reform, it is concealment. The registry shutdown wasn't a glitch. It was a cover. The Master Health Facility Registry is not just a website. It's the National Book of Truth, showing which hospitals exist, which are licensed, and which are ghosts. When it goes dark, accountability goes with it. And without accountability, billions meant for Kenyans' health care risk vanishing into thin air. Then came Ladnan Hospital's statement. Facing questions over conflict of interest with SHA chairperson Abdi Mohammed, the hospital drew a hard line. CEO Kanyenje Gakombe explained that Ladnan is now a subsidiary of Metropolitan Hospital Holdings Limited, owned by over 500 shareholders, and that Mohammed sold his entire stake in July 2023. Translation: no role in ownership, no role in management, no ties whatsoever. Yet, Ladnan is also in the spotlight for another reason, allegedly receiving over 124 million Kenyan shillings from SHA between June and August. The contradiction is glaring. If ghost hospitals were shut in May, why was such massive payments still flowing months later?
These concerns now being raised are not new to us. They have been an integral part of our public discourse and enforcement actions from the very beginning.
And Ladnan isn't the only one. Records show Nyandiwa Health Center, an abandoned facility in Nyanza, was allocated 20 million Kenyan shillings from SHA. Duale explained it away. The dispensary was upgraded to Nyandiwa Level 4 Hospital, but the old account name wasn't changed. Still, payment records showed funds flowing to both Nyandiwa Health Center and Nyandiwa Level 4 Hospital. To Kenyans, that feels less like an upgrade, more like a duplication. Taking to his X account, Duale posted, quote, "No amount of propaganda or blackmail will deter us from fixing our healthcare system. We know saboteurs of SHA have recruited several groups, including some sections of the media, to advance their agenda. Let them be warned. We are fixing this thing regardless of the noise. Our work has just begun. We will not rest until every Kenyan has access to quality, affordable, and dignified healthcare free from the burden of fraud." Unquote. Cyprian Nyakundi responded, "There is no way Aden Duale can solve the same theft he caused. On one hand, he says he's fighting SHA graft. On the other hand, he is attacking and maligning those asking questions. He is here and there. Duale must go. Arrest Duale." Pauline Njoroge posted, "Ladnan Hospital has fraudulently received millions of shillings from SHA. Yet instead of confronting this massive theft, Duale is busy trying to exonerate the hospital's founder Abdi Mohammed, who conveniently also serves as the chairman of SHA. But this is bigger than one hospital or one individual. It exposes an administration that has perfected the art of stealing from Kenyans. Billions meant for the sick, the poor and the vulnerable are being diverted into some people's pockets. Meanwhile, genuine cases are ignored. Patients are turned away without treatment. Hospitals run out of drugs and families are pushed into poverty to pay for healthcare the state should provide, and for which Kenyans are already bleeding through their taxes. And were we not told that the shift from NHIF to SHA was meant to curb such scams? That the technology system which cost Kenyans 104 billion Kenyan shillings was impenetrable, built to seal loopholes and block fraudulent claims? So what happened? Why am I even asking? We all know where that money went." Unquote. Boni Khalwale responded, "If a political debt is due to Honorable Aden Duale, whoever owes him should not expect Kenyans to repay him with their blood and lives through scandalous SHA. CS Duale must go." Aaron Cheruyot posted, "CS Honorable Aden Duale, keep your eyes on the prize. UHC must be attained. Do not be intimidated by the corrupt media peddling falsehoods sponsored by cartels who have gamed our healthcare system in public and private avenues to near collapse. This is a war you cannot afford to lose." But at Sholad_Man City responded to Aaron Cheruyot, "I saw the tweet you deleted, and you should know we are not fools. You claim we are peddling falsehoods. But Aaron Cheruyot, every tweet exposing Duale and SHA has included data and screenshots from the official SHA website. It's SHA's own data. So what falsehoods are you talking about? Secondly, you say Duale has exposed hospitals doing wrong. A simple question. Why haven't the owners of those hospitals who already received money from SHA before suspension been arrested? What about the rest of the ghost hospitals? What you're trying to do won't work. Duale belongs in jail. Duale is a criminal. Kenyans are not paying SHA monthly just for that money to be stolen." Unquote. Duale has doubled down, dismissing the ghost hospital scandal as media fabrication, but the irony is biting. The very data being called fabrication came from the Master Registry itself before it was shut down. The optics are brutal. Shut down the registry, then call the data fake. This is more than a health debate. It's a battle of narratives. To defenders like Ahmednasir, this is the painful birth of reform. To critics like Otieno, it is the deliberate burial of transparency. To hospitals like Ladnan, it's reputational survival. And to ordinary Kenyans, it's yet another scandal where leaders argue while patients suffer. The Master Registry was built to clean up Kenya's chaotic health records after decades of ghost hospitals draining funds. By May, Duale announced over 700 unlicensed facilities had been shut, but payouts continued in June, July, and August. Add the shutdown of the registry, and the contradiction is complete. Reforms on paper, leakage in practice. So the real question isn't whether ghost hospitals exist. It's whether Kenya's leaders will stop feeding them. What do you think? Drop your comments. Newsroom, Maisha TV, Bushabe Jr.